Good afternoon and welcome. Thank you for joining us today. My name is Samantha and I'm the Director of Member and Partner Services for the Florida Association of ACOs. We are very excited for this opportunity to present you with our next installment of our webinar series, From Data to Value, a winning approach to achieve data excellence and ace the VBC world. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You will see a user control panel on the bottom of your computer desktop. You can listen in via your computer speakers, or if you would prefer to join over the phone, just select Join Audio and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing your questions into the Questions tab. You may send in your questions at any time during this presentation. We will collect these and address them during the question and answer session at the end of today's presentation. With that, I'm going to turn the presentation over to Dr. Mehta. Thank you.
All right, thank you. So thank you all for joining today. We will get started. So today we're going to be talking about how we can take data to value. All right. So today with me, I will have our Chief Technology Officer, Mohammed Kashif, joining us. He's been in the healthcare IT space for a number of years, for over 20 years now. He's very well experienced with it. I myself am Dr. Shardul Mehta. I'm the client solution architect here at Presidio, and I've been with the company for a little over eight years now. Now, what we'll be talking about, so imagine an organization dealing with large patient populations and participating in multiple value-based contracts. Like the average healthcare organization, it is probably juggling multiple health plans, multiple value-based care programs, multiple data feeds, including multiple EHRs, HIEs, claims feeds, things like that. Not to mention employed provider networks, affiliated provider networks, things like that. Now, these data challenges trickle down to major challenges for frontline nurses and caregivers. They struggle to provide the right care to the patient and find themselves in providing reactive care most of the time. They end up logging into multiple systems to get a holistic view of their patient populations, end up sorting through non-actionable data, manually risk stratifying patients, creating chase lists manually, all while struggling to provide a high quality of care to their patients. A large contributor to the complexity of healthcare is the sheer amount of data generated in the healthcare industry. That data has been growing by 48% every year. That means in 2022 alone, the healthcare industry is projected to generate over 4 zettabytes of data. To put that in perspective, that is equivalent of over 262 million years worth of HD movies. Not only is there an immense amount of data being generated every year, but the data that is generated must be retained longer than most industries, and the tsunami of data coupled with industry inefficiencies makes healthcare ripe for digital innovation to enable stakeholders to transform this disparate and siloed patient data into insightful and actionable data. The staggering amount of data can be overwhelming. It poses healthcare leaders with several questions. My organization has lots of data from multiple data sources, but what do I do with it? Our patients and my leadership expect us to use this data to make evidence-based decisions. How do we start? How can I use my organization's data to make smarter, more cost-effective decisions? All healthcare organizations are juggling data from multiple sources and struggling to manage big data and the big challenges that come with it. For example, data is scattered across different teams within the organization. Oftentimes, an organization will use multiple systems to manage and document their data. This results in isolated data silos. Even managing the flow of data becomes a complex task. It is not enough to create the connections, but those connections need to be continuously monitored and managed to ensure any issues that arise are addressed efficiently in a timely manner. The format of data can vary from data feed to data feed. Data is transmitted in multiple formats and standards, including HL7 FHIR, CDA, even custom proprietary formats. Integrating data from multiple data sources, allowing organizations to manage all of their value-based care contracts becomes of the utmost importance. Ensuring the incoming data is secure, and dealing with unstructured data. Approximately 80% of all healthcare data is unstructured, but still clinically relevant. There are many components to social determinants of health, and each component has 30 to 50 distinct data elements. There are multiple organizations who generate this data, and each one uses their own data model and format, leading to thousands of combinations that a recipient has to manage. Multiple interoperability standards are leading to data sharing challenges. Data latency poses concerns for data availability. Will your organization achieve the timeliness requirements to support compliance? Analytics tend to be limited due to a number of factors, including data fragmentation. Enriched data with actionable insights within a single integrated system is still a challenge. Keeping up with changing regulations like the CMS interoperability rule, and more recently, health equity is more important than ever. The way out of this minefield of obstacles is through data excellence, by using a system that is able to work with multiple formats and standards to ensure seamless interoperability across multiple disparate data sources. One of those data sources are integrated into a single. So those data sources would be integrated into a single longitudinal patient record that needs to be curated and maintained as the source of truth for patient care across the care continuum. With interoperability and a single longitudinal patient record, healthcare organizations will be ready for future rulemaking, like embracing FHIR standards, delivering proactive care, driving business value to manage multiple value-based care contracts, from risk adjustment, quality improvement, care coordination, and analytics. Improving health and administrative cost improvement, as well as member and provider experience. Promoting equity and improving organizational efficiency with process and workflow automation, are all needed to achieve data excellence. So how do we get there? How do we achieve that data excellence? Well, it all starts with the longitudinal patient record. The longitudinal patient record takes multiple data sources and gives our teams a holistic view of their patients, allowing them to improve operational efficiency, where they no longer have to log into multiple systems. This single longitudinal view of patients allows organizations to effectively manage patients' risk, quality, care, cost, and analytics from a single view. Interoperability is achieved when multiple systems communicate with one another by accessing, exchanging, and making use of data in a seamless, coordinated manner to achieve a common healthcare goal. It's the cornerstone of value-based care programs and is now mandated by the CMS interoperability rule. While the new CMS interoperability rule presents significant implementation challenges, its effective compliance will position organizations to deliver health value to members by empowering them to effectively manage data across the continuum of care. A data platform of the future to achieve data excellence should provide a single longitudinal patient record that provides a 360-degree view of all patient-related data, streamline workflows and data flows, support all value-based care arrangements, and accelerate compliance. A platform that combines those three elements offers three core benefits: data fluidity, scalability, and accountability. The Presidio data platform is one such platform that serves all your data needs, increases provider productivity, engages patients and caregivers, enhances quality performance, improves affordability, and expands access to care while promoting equity. The Presidio data platform treats your data as a living, breathing entity. By automating your data pipeline, it helps drive true value and insights across the lifecycle. The beauty of the platform is that it has the ability to consolidate data from all sources, making sure that every data point is truly captured to help you paint a complete picture of your patients. The data is prepared in a way that brings the most actionable information and insights to the care providers, allowing them to streamline multiple value-based care contracts by presenting that data in any required format and standard, promoting seamless care coordination and meeting all interoperability needs. The platform integrates with all major EHRs and allows bidirectional data flow from EHRs to the Presidio data platform and back to the EHRs, making sure that records are always updated with the most recent changes and updates from our teams. The data in the Presidio data platform is first acquired and combined with multiple data sources, including social determinants of health data. It is then aggregated using our own EMPI. The data is then normalized to map complex data structures and enhance member attribution processes. Machine learning and natural language processing is used to gather insights from unstructured data, such as physician notes. And all of the data is then curated into a single longitudinal patient record that is augmented with actionable insights and analytics. This new actionable patient record is ready to be used in different business applications in the Presidio CareSpace platform. Here, we can see how the single consolidated patient record with actionable insights and workflows are surfaced to the CareSpace's users in one of two ways. Care managers, analysts, executives, quality managers can access multiple workflows, modules, and insights directly within the CareSpace platform. For providers who are less inclined to log into another system outside of their EHR, we provide the Presidio CareTrack extension. The CareTrack extension provides all of the clinical insights, bidirectional workflows, including HCC risk adjustment, things like that, alongside the provider's EHR, without the need for the provider to search for any patients or log in as well. Many clients have used the Presidio platform to achieve a high level of success. One such client is Mclaren Healthcare, based in Michigan. Mclaren is a large healthcare organization with 14 hospitals, over 1,100 practices, over 4,400 providers that are both employed and affiliated. They have an ACO and they participate in multiple value-based care contracts. As you can imagine, they have a complex data landscape with over 20 different EHRs, 7 unique claims feeds, and HIE, including live stream ADT feeds. Presidio was able to help standardize data across the entire network to effectively drive care coordination and management, risk stratification, cost analytics, registries, and HEDIS measure not only monitoring, but also reporting. And all of this was delivered within 2 months of a signed contract. All of the different data feeds, all of the training, and everything was accomplished within 2 months. And they were able to start seeing value within 2 months of their signed contract. Now, with our system, their ACO was able to boast $34 million in shared savings alone. Another Presidio client, Prime Healthcare, has 45 hospitals across 14 states, over 300 outpatient locations, and uses over 10 different EHRs. Presidio supports Prime for multiple value-based care initiatives, including BPCI Advanced and helping to promote health equity. The Presidio data platform and CareSpace work together to serve as the key enabler to promote Prime Healthcare's initiative for improving and promoting social determinants of health at a system level, allowing the Prime team to connect with community resource partners and track patients' well-being in real time. Right. So the way that worked is after discharge, The community partners shared patients' progress via the CareSpace portal, thus establishing a bi-directional exchange of patient updates and transparency between the prime hospitals and their community partners. This information was further analyzed to study the program's effectiveness in achieving better patient outcomes, better experiences, and lower costs. CareSpace presented them with social determinants of health in real time and helped monitor patients remotely. These efforts and this initiative resulted in Prime Healthcare winning the 20th John M. Eisenberg Patient Safety and Quality Award at the national level for implementing a cohesive and system-wide approach to addressing social determinants of health. Now, Presidio has been helping its clients achieve high levels of success since 2004. Over that time, we have come to serve 3 state departments of public health, 7 EHRs, where we actually provide them with clinical decision support solutions embedded directly within their EHRs. We work with 19 payers. We serve over 200 hospitals across the country. We have over 800 skilled nursing facilities within our post-acute care networks. We're connected to over 2,000 labs and over 35,000 physicians touch our system in some way, shape, or form. Now, over that time, we have invested over $75 million into our platform. We have curated well over 20 million patient records and managed over 60 million encounters. Our single consolidated patient records can contain over 1,600 unique data points per patient record. Now, we touched on some of the key relationships that Presidio has with its clients. So we have Mclaren Healthcare, Prime Healthcare, and US Medical Management. We provide them with services ranging from data connectivity and data aggregation, care management, care coordination, quality management, reporting, cost and utilization analytics, risk adjustment, telehealth and telemedicine, configurable health risk assessments, and the like. We have a proven track record where the success speaks for itself. We have been able to help our clients avoid one of our clients avoid over $11 million in penalties, $34 million in savings. We've helped our clients move from different programs like the ACO program over to the bundle payments program, and we've also helped our clients' teams increase efficiency. So, for example, a 90% reduction in time and effort for nurses performing risk stratification. Thank you. Any questions, Samantha?
Yeah, so it looks like we do have one. If you consolidate all data sources, how do you manage those data feeds, and how's that presented to the user case managers?
I'm sorry, could you please repeat that? The audio broke up a little bit.
Yeah, no problem. If you consolidate all data sources, how do you manage those data feeds, and how's that presented to the user case managers?
Sure. So of course, as anytime we're consolidating multiple data feeds into a single longitudinal patient record, that's a complex process. So what we do is we actually have multiple dashboards with notifications built into our platform. Now, these are monitored not only by our Presidio team and our Presidio support team, but they can also be made available to our clients as well, where they can monitor their dashboards as well. So we can monitor individual data feeds coming in from individual practices, from HIEs, from EHRs. We can see the data latency behind each of those data feeds. We can see if in case of a feed going down, there are notifications that are configured to notify all stakeholders in case of an issue. So that way all issues can be addressed in a quick and timely manner. Now, as far as, so those dashboards can be presented to our end users. Another way that our end users can see the multiple sources of data is that we actually tag the source of each data element within our user interface. So as a care manager is reviewing the patient's full longitudinal patient record, they would be able to see multiple icons associated with each data element, letting them know exactly where that individual data element originated.
Okay, and one last question that I do have today. Let's say a certain gap for the patient is still there in the system, but it has been closed, and due to lags and system updates, it's not showing in the records, which providers find frustrating. Does your system update information in real time and notifies if something has been altered?
Yes, so our system can process data in real time um, as the information is getting updated. So in that particular, in many scenarios, what we would do is we would identify a potential gap in care, um, and we can even, so in the case of a gap in care for a quality measure, we can actually identify exactly what codes were documented, when they were documented, so we can trace them back. If a particular um, a code or a gap was incorrectly being triggered, we can also work with our clients to identify exactly why, and we can work with them to improve any sort of documentation. We can, and even on any best practices for documentation, and we can also work with our clients to um, update any sort of backend mappings to make sure that that sort of an issue does not happen again.
Okay, that's all the questions that we have today. Thank you for presenting this information to us. And we will be sending an email with contact information if you have any follow-up questions, along with a link to the webinar recording. Please feel free to share this link with anyone you may think is interested, and watch your emails for upcoming webinar announcements. Also, as a reminder, the FLACOS conference is this October 17th through 19th in Orlando. We hope to see you there. Have a great day.